Hello, I'm Dr. Laura Murillo, President and CEO of the Houston Hispanic Chamber of Commerce. Over the decades, your chamber has endorsed and supported many bond referendums. Especially important was the one that we most recently supported, which was the Harris Health System. You're going to learn a lot more about that from their president and CEO. He's joining us here today, and that's Esmaeil Porsa. Thank you so much for joining us, Doctor.
Thank you so much for having me. It's a pleasure.
Thank you. And we know that Houston is the epicenter for medicine. We also understand that our demographics, our population has increased by leaps and bounds, hence the need for this bond referendum for Harris Health. Tell us more for folks who may not know what Harris Health is and what you do.
Well, thank you very much, first and foremost, for having this conversation. Harris Health System is the safety net hospital system for Harris County. Probably the largest one in Texas, maybe the fourth largest in the entire country. We have two hospitals, a level 3 trauma center hospital, LBJ, a level 1 trauma center, one of only two in Harris County, that's Ben Taub Hospital. But in addition to that, really majority of our work is done in the community. For example, both of our hospitals put together have about 40, maybe 50,000 patient encounters, 150,000 ER visits, about 5,000 deliveries. But on the outpatient side, we have 1.6 million encounters annually. That's about 250,000 unduplicated lives. And yes, we are the safety net hospital system for Harris County, a county of now almost more than 5 million people. Very unfortunately, also the county that has the highest rate and number of uninsured in the country. Right now, that number is over 1 million people, which is very unfortunate.
It is, and let's talk a little bit about disparity. And quite frankly, one of the reasons this is so very important, it's an effort to address these disparities, especially among low-income minority communities in our city.
Yeah, so what I've always said, and that's the mission of Harris Health System, is to improve the health of our community, especially those who need us the most, those who otherwise would not have access to care. And what I've always maintained is that your insurance status, you being insured, uninsured, should not determine your level of access to healthcare. So we are here to provide access to everyone. To your point about health disparities, Harris Health System, just by the nature of who we are, we have always engaged in addressing health disparities. But to bring focus to this effort, in addition to our existing population health platform, we are actually creating a center for health equity, which is going to go live, I guess, later this year, which include also recruitment of an executive director for this center. The reason for that, again, is not something new that we are doing, but it's really to bring focus to this effort. I'm going to give you a couple of examples of what I mean by that exactly. One of the things that Harris Health System is proud to have been doing now for several years is our food pharmacy program. We actually have a farm outside of LBJ Hospital that we are planning on expanding. As far as I know, we are one of probably a handful of hospitals in the country that have our own farm. But in addition to that, we have food pharmacies in our clinics and at LBJ Hospital where patients who are identified as struggling with food security can receive a prescription from our doctors that can then go to our food pharmacies, meet with the dietitian and the case manager, and receive fresh foods, vegetables, produce, things of that nature every couple of weeks. This program is for 6 months. At the end of the 6 months, there's a determination if the patient is still suffering from food insecurity, at which point we either continue them in our program or we connect them to care through the Houston Food Bank, or we can graduate them from the program. The other one that I'm really excited about, and you may know this, some of the audience may know this, that in addition to struggling with the number of uninsured, Harris County, actually the entire United States, has an issue with maternal morbidity and mortality, especially among the population of color. So in order to address that, Harris Health System again has partnered with the School of Public Health and other community-based organizations, and we are now providing remote patient monitoring for our at-risk pregnant mothers, those who have diabetes and hypertension. I am really, really excited about this program. This program just went live about a month ago, and I really believe it's going to have a huge impact on reducing the maternal morbidity and mortality that we're experiencing in this county.
All very important, Doctor, and we are very excited about this opportunity. Of course, we know that there'll be more hiring as a result, and we all know there's a shortage of workforce, and so we are also cognizant of that, and we are here to provide support for those that are most in need of these opportunities, whether it's for healthcare, for opportunities. And I know we've had many conversations regarding the importance of procurement and opportunities for businesses within the Harris Health System throughout the county. So we appreciate you embracing that and partnering with the Houston Hispanic Chamber of Commerce. Thanks for all that you do, and we look forward to seeing you very soon.